Hi everyone, my name's Judy Porter and I'm Editor-in-Chief of Nutrition and Dietetics. I'm really pleased that we've got so much interest in our first Research Bytes session. These sessions we're aiming to hold 3 to 4 times a year to really help to expand the translation and impact of research that's published in nutrition and dietetics into practice. So these are going to run similar to a conference presentation, and there'll be opportunity for you to add questions through the Q&A. We'll invite the presenters to answer the questions, also to contribute to a brief panel at the end of the session. So hoping that you find the session really useful. We've got lots of people registered for the session and hopefully it runs really well today. Before I continue though, I'd like to ask you all to please take a moment to acknowledge the traditional custodians of the land on which we are meeting. And for me at Burwood campus, that's the Wurundjeri people. And I'd like to pay respects to their elders past and present. I extend that respect to all Aboriginal and Torres Strait Islander people who are with us today. Our next presenter today is Flavia Fayet-Moore, who many of you may know leads a team of highly skilled researchers and communicators to conduct end-to-end nutrition and science translation projects. Flavia is a member of the NSA, Dietitians Australia, and is also a founding board member and fellow of the Australasian Society of Lifestyle Medicine, and she's passionate about improving the health of Australians, especially amongst children and adolescents, through research that has impacts. So Flavia, welcome, and I'd like to hand over to you to hear about your research. Thank you.
Perfect, thank you, Judy. So as my bio says, I'm so excited to be here today because research is really only good when it's translated. So thank you so much for the opportunity to come and present our work and our research. So my presentation today is all about how Australians, adults, are actually following and choosing very low calorie diets. Why do we care? We care because in Australia, we have a unique environment where VLCD diets are self-initiated. It's not mandatory to have a healthcare professional guidance, dietitian or GP or other. So, but because this is a massive study and there's a lot of information, I'm going to focus on what's relevant to you guys as dietitians or healthcare professionals, so you can use some of the factors that we found that influence the perceived success in following VLCDs, so you can help empower your patients, potentially change your model of care, using the information to help better support them to overcome those barriers. So before I started, just to acknowledge that it wasn't me who did the study, it was my team, and specifically acknowledging our qualitative experts. I'm not a qualitative expert, so if you have any nitty-gritty question, I might have to refer you to my co-authors. But this was published in Nutrition and Dietetics at the end of last year. It was funded by Nestlé Health Sciences, but all as authors in the study have no conflicts of interest to declare. So why research the barriers and facilitators? Why do a qualitative study? Well, we know, as dietitians that VLCDs are recommended. They're recommended in the RACPG guidelines for weight management. They're also recommended prior to bariatric surgery and also for diabetes management. But because of that self-initiated environment, we know that there's plenty of evidence showing they work, but we actually don't know how people are using it. We don't know what their barriers are, facilitators to adhere. There was a lot of talk in the previous presentation about adherence. So this is what's relevant to you as dietitians, to figure out what are the factors that actually help someone adhere to a diet for a long period of time. So we are describing the experiences in people using VLCD in Australia that use at least one product daily and for at least 4 weeks. So what did we do? We recruited for about 6 months, and we had 178 people do the screening questionnaire, of which 31 actually completed the study. Now, in terms of inclusion criteria, it was adults up to 65 years of age and who had no contraindications of using the program. So we obtained cross-sectional data to get some of that demographics, product use, weight loss. We then did the semi-structured one-to-one interviews where we obtained all the qualitative information. and performed an inductive thematic analysis to get those themes and factors and the theoretical framework of how adults in Australia choose and follow very low calorie diets. So here's a quick snapshot of the participants. You probably won't be surprised by it. They're predominantly female. They were in a relationship, highly educated, and the majority had a BMI greater than or equal to 30. What was interesting is that about half were first-time users, but the other half came back to the program. So it wasn't the first time that they had followed a very low-calorie diet. Most were aware that there was healthcare professional support, but they didn't really engage us. Only 40% actually was using a healthcare professional. Weight loss ranged from the 4 weeks in inclusion to up to 22 months being on the program, and they lost self-reported between 3 to 90 kilos. What was interesting here is that there was a very strong 0.7 correlation between the length of time on the program and the amount of weight lost, but no correlation with age or perhaps how many times they've been on the program previously. So this is the theoretical framework that was developed from the thematic analysis. So there are 2 themes identified on choosing and following the VLCD program, but that's way too much for me to talk about in 8 minutes. So I'm going to be focusing on those factors that helped, that were related to a perceived outcome on the VLCD, and it included the individual factors, environmental factors, and program structure factors. So these are the 3 factors in your head as dietitians that you have to think about when you're dealing with a patient or client choosing and following very low calorie diets. So what are the individual factors that we identified? It was really clear that participants reported this all or nothing mindset. They were either experiencing it or they were actively trying to avoid it. They also reported the need to have realistic expectations of their journey following the diet. So they reported using self-compassion as a core way to allow them to have that flexibility when there are periods where they're adhering to it well and other periods where adherence is quite low. They also talked about how planning and preparation was important. So they included examples like making sure they read a menu before they go out to dinner to a restaurant, or making sure they plan their meals for the week, or take the appropriate snacks with them. They also identified emotional distress, emotional eating, and symptoms of depression as being associated with adherence to the program, so a barrier to adhering to it. What about environmental factors? Well, social gathering was very consistent, a consistent barrier that was reported, which led them to change behavior and consequently change their adherence to the program. So they would either avoid, for example, a social occasion or a birthday party altogether, or they changed their behavior during it, which meant that they were gonna change how they were following the program during that social gathering. Online support group was so consistent. It was something that everyone reported needing, that online support, but it was quite mixed. For some people, it was motivating, whereas for others, it was really harmful to their motivation, that having those experiences of other people didn't help them follow the program, whereas others really needed it to be motivated and follow it. There's also the healthcare professionals. So unfortunately, we were minimally engaged. Specifically, dietitians were minimally engaged. There was diverse experiences reported with the different types of healthcare professionals, from psychologists to doctors. But even among those that engaged healthcare professionals, there wasn't a lot of check-ins and follow-ups with their healthcare professional, as you would expect, especially in other countries where that's mandatory. In terms of family, family was a very important factor for their adherence. So if you had a supportive family, it helped. And families who weren't so supportive, there was more deviations from the program and more foods not recommended being consumed. The workplace as well. So this was a pre-COVID study. And during the workplace, participants reported that travel was a barrier, colleagues judging them and what they're doing in terms of their weight loss journey was a barrier, or potentially having to deal with stressful situations which didn't allow them to follow the VLCD. And with respect to educational materials, they often use that online support groups or online medium to obtain supplementary information on how they should be following the program, but also to get ideas on recipes and other information to help clarify how to utilize the program. Now, what about program structure factors of how it's actually recommended? Flexibility was by far one of the most popular factor being reported. Participants modified all 3 levels of the program. So they either took one out altogether, or they extended it to suit their lifestyle or to suit their weight loss. So they might come back to an intensive phase, or they might extend the intensive phase. The next was choice limitation. Again, why we need to really understand our clients, because for some people, choice limitation was great. You know, like Lynn mentioned, they like to be told exactly what to eat and they'll follow it. Whereas having that choice limitation led other people to deviate more from the foods that they need to be consuming. Convenience was consistently reported as something that participants found that helped their program adherence. Cost was, the program was consistently reported as being costly, but participants acknowledged that it's still cheaper than following a regular diet. But none of them reported cost as a barrier to adhering to the program. Flavors, some participants reported the flavor, variety, and type to help them, and others to limit their ability to adhere to the diet. And last but not least, from a dietetic perspective, adverse symptoms were consistently reported, minor adverse symptoms like hair loss or gastrointestinal upset, but participants were more willing to experience those minor symptoms than to cease the program, which is really interesting. So what are some of the take-home messages? Well, healthcare professionals are minimally engaged. They were not seen by participants to be essential. So it's a real opportunity for us to use some of this information from the research to help create a better model of care for the participants, to help you to use some of these factors, like probing maybe in your initial assessment about family structure, about their flexibility and how they want to approach the program, or coaching them for self-compassion to help motivate them for behavior change. So there's lots of different ways that we can utilize this information as healthcare professionals to help our patients, but also to understand what your patient is likely going to experience by being across all this, to know and be able to relate to their experiences. And last but not least, we're conducting phase 2 of the study right now. We're about to start recruitment. And this is further research to expand that inclusion criteria to not just 4 weeks or more, because we know that people are using it in quite a flexible way, but also to add on other components like eating behavior, to see if eating behavior explains how some participants like structure and others don't. And also look at other factors like quality of life and so on. So thank you very much. Look forward to the questions now.
Flavia, qualitative research, amazing, right? It just gives such a level of depth to understanding about what works for people and why it works. That was amazing. Thank you.
Yeah, it's the why in dietetics, which we don't often see.
Yeah, I loved it. And I also was interested in your point around it was a pre-pandemic study. So I was interested, you know, people challenges with the going on the bus and influences of the workplace. I mean, I know you probably haven't extended that study through the pandemic, but can you sort of predict what may have played out based on your interviews with those participants?
Well, we're doing phase 2 now, so it will be during the pandemic. So it'll be, I mean, a little bit different in Australia compared to the rest of the world, but it'll be interesting to see if that workplace environment has the same type of effect. I mean, maybe the family environment or the home structure will have a bigger influence on their outcomes. Or maybe there'll be the fact that they're working from home might be another factor that's newly identified, because then they have access to the kitchen, they have access to family members interrupting and influencing their adherence. So it'd be very interesting to compare as an extension of the first research.
Yeah, great. Excellent. Thank you. We've had a few questions come through, Flavia. One super interesting presentation, and that you found that some people found the online support group useful while others didn't. Perhaps it implies that dietitians should have a discussion with patients to really think about what would support them best, and normalise that some people don't get benefit from all strategies. It can in fact be harmful. What do you think?
Yeah, exactly. So from that, I guess, how can you take that to practice is potentially offering an online forum for people on VLCDs that might be moderated by a dietitian, so you can control some of the posts and the dialogues and the information. Because, I mean, there was, when we did the study, there was nothing official in terms of online support. These were just online support groups that the users were actually creating themselves. So there is no healthcare professional moderation or anything in those forums. And I'd say that's probably why some people might have such negative experiences, and it might harm their motivation. But at the same time, it might just be related to their profile, their psychological profile, which we want to investigate more in the next study. That, you know, I know from my work in eating behavior, those who are quite restricted and have high disinhibition, they're probably the ones you want to monitor more in those social gathering factors, because they're more likely to disinhibit and change their program. Whereas the highly restrictive ones that have low disinhibition, they can probably stick to it because they're the ones that like the structure and they just follow it. So it really depends. To answer your question, it depends really, I think, on an individual factor, but from a environmental factor, I think we can, as dietitians, can provide that support online because they want it, and they want it for information to supplement the program or to supplement what their doctors are giving them.
Yeah, that's great. So amazing similarities, actually, that in the systematic review from Linda.
Yes, I know. When she was listening, I was like, this is so cool.
yeah, that's right. And also some very impressive weight loss there. One question here: weight loss was seen across durations. Do you know if it was maintained or regained?
Well, because it's not really a quantitative study, so we're not measuring that. It's all about the experiences. But on average, participants lost about 20 kilos, I believe, and they lasted on average about 5 months. But I think one of the key themes coming out of this is that maybe adherence is not really everything, right? It's there maybe taking into account all those other external factors and internal factors have a huge part to play on the weight loss that's observed, not just purely if you're adhering to it or not.
Yeah, absolutely.
Because we saw significant weight loss, and the biggest factor is how long they were in the program. And we know that there was huge flexibility. They weren't following it exactly as recommended, and they still got results. So I think it's important for us dietitians, especially working in private practice and seeing patients or in hospitals, pre-bariatric surgery or whatnot, to probe for these things, because you'll create a better model of care for your patient, taking all these factors into account.
Flavia, thank you. Amazing how the 3 presentations we've had so far have built on each other. So that was really powerful. Thanks.